Time Tri-Cities is sponsored by ETSU Health. Once again, it is time to meet your provider with ETSU Health, and today we're talking with Dr. Stephanie Layne. Doctor, thanks for joining us here today. Let's talk about pediatrics because that's your specialty.
That is my specialty, and I wouldn't do anything else. It's my
wouldn't
favorite
do
area.
Anything else.
Yep, that's the one.
What initially led you into pediatrics?
So I've always really liked working with kids, even before I went to medical school, and did lots of babysitting. I used to be like a summer day camp counselor, and honestly, those experiences were really, really rewarding and kind of carried on with me through medical school. So
Right.
I just love working with kids.
In addition to pediatrics, Dr. Layne has a background in osteopathic medicine, a background that served her well on her journey to joining ETSU Health.
During medical school, I really fell in love with mountains,
Right.
and I actually came here for a month as a fourth-year medical student in the adolescent medicine department. I worked with Dr. Chastain at the time, and I really, really loved my time here. And it was nice to have my husband's family not too far away, so everything kind of fell into place with life, and I'm here on faculty now.
You found a home here in the mountains of East Tennessee.
Yeah, absolutely. Our really good friends are here. Our support system is here, and so I think it's the people that really makes the place feel like home. And it doesn't hurt that it's so pretty.
Dr. Layne says that early on she knew that pediatrics was definitely her mission in life.
Well, I really kind of went into my clinical rotations as a medical student with an open mind. I'd had a few people tell me, "You're going to be a pediatrician." I was like, "I don't know about that. We'll see." And I had my pediatric rotation a little over halfway through my third year of medical school, and up to that point, I had kind of liked everything. I was like, "Oh, well, maybe I'll just do like family medicine, where you get to do a little bit of everything."
Right.
And I got to my pediatric rotation, and I realized my third day in, I was like, I have a big smile on my face the entire drive in, and a huge smile on my entire drive home. This is what I want to do for the rest of my life.
It's nice when you get up in the morning, you look in the mirror, and you know you're going to do a job that you're meant to do, isn't it?
Yes.
You get that feeling?
A lot of days I do, and other days, I'm not going to lie,
it's
some
like
days are
everybody
tough.
else.
Yeah, some days are tough.
Right.
But on the whole, it's been a very rewarding time here and working in pediatrics.
Let's get away from the professional side for just a moment. Talk about the personal side of your life. Let's talk about your family. Tell us about your family.
So I have a husband
Right.
and a 2-year-old who, he's a handful. And then we've got 2 fur babies at home, which are
Okay.
sometimes just as demanding as the child. But really, as I try to do as much of my work at work, and then I
Right.
try to be as present as I can at home. I try to not do work from home if I can, just so I can be there and spend that quality time with my family. So I tell myself a good day, and this also applies into medicine, a good day is when I can make a kid smile, and it's the best day when I can make my kid smile. So if I can do that, I can get that one-on-one quality time, even if it's just for 5 or 10 minutes with my kid, if it's a busy day. I call that a really good day.
Let's talk about the future of pediatrics in this, especially in this region here in the Appalachian Highlands. What do you see as the future of pediatrics here?
That's a great question. So right now, I think our clinic, one of the really unique things about our clinic is we have an integrated model. And what that means is we have not just pediatricians that work in our clinic, but we also have a behavioral health team and a resource team that works in our clinic. And prior to coming to ETSU, I was working private practice in North Carolina, and a third of our visits relate to behavioral health. So I think is a huge trend across the board for what pediatricians are seeing, is there's a huge demand for behavioral health interventions and support. And so it's amazing that our clinic gets to have that integrated model and those specialists. And so I hope and I anticipate that that's going to be a continued trend, just because there is such a demand for that kind of support with families.
And I talked to other doctors for this series, and to a person, each one of them says it's teamwork. It is the whole team at ETSU Health working together to get those great outcomes.
Yes.
Do you see that as well?
Absolutely, yes. It takes a village, not just to raise a child, but also to have good, healthy support for our children. It takes a village.
All right. Doctor, we appreciate you.
Yeah, thank
Thank
you
you
so
for all
much.
you're doing.
I appreciate
And
it.
thanks for taking the time out. Great conversation.
Yeah,
with you.
thank you. Nice meeting
so
you.
much. Dr. Stephanie Layne, thank you so much. That's this week's Meet Your Provider with ETSU Health. The preceding portion of Daytime Tri-Cities was sponsored by ETSU Health.